The United Nations, in its much-publicized Declaration of Commitment of 2001, has made it clear that the advancement of human rights and fundamental freedom for all is an essential element of the global response to the AIDS pandemic. In keeping with this thrust, UNAIDS has urged all governments and key stakeholders like the media to safeguard and advance the rights of all vulnerable communities, especially people living with HIV/AIDS. In the light of this commitment, the historic and momentous step taken by the Press Council of India assumes great significance. In partnership with UNAIDS, UNDP, UNICEF and NACO, the Press Council of India released the National Guidelines on HIV Reporting on the 16th of November 2008. Even while all this was happening, we saw the beginnings of a strong transformation on the ground. Much of this can be credited to different communities, like people living with HIV, sex workers, transgender, intravenous drug users, and men having sex with men. They had realized early on that the epidemic was hidden because of its highly negative association with immorality and death. In 2005, when the communities, with the support of the Center for Advocacy and Research, took stock of the quantity of coverage and the representation of communities adversely affected by and living with HIV, they found contradictory trends. While 30% of the total reports were on marginal communities, what was worrisome was the fact that 45% of the reports specifically on marginal communities such as sex workers, transgenders, MSMs and IDUs were negative. In fact, while the Press Council was effecting policy changes, the communities were adopting the not-so-easy option of reaching out to the media and removing age-old biases and misinformation about them and their lives. And this was possible because of the support that many journalists extended to this cause.
पहला मैं किसी को ओपनली मैं सेक्स वर्क करती हूँ करके किसी से ओपनली मैं नहीं आती थी. वो मेरा एक ஐடென்டிட்டி देना मेरा एक बड़ा बदलाव आया है.
நிறைய முடி வளர்த்துக்கணும், புடவை கட்டணும், மற்ற பெண்களை பார்க்கும்போது அவங்கள மாதிரி நம்மளும் அழகா இருக்கணும் அப்படிங்கிற ஒரு ஆசை வரும்.
To achieve this, they faced tremendous odds. The engagement with the media was not without attendant risks and challenges for the community. When the women from the Mukta project in Maharashtra were planning to organize a rally, because a high-profile event was needed to put out the message, many women decided to come forward for the first time, face the camera, and speak up. This was a difficult decision, and there was understandable apprehension about the possible fallout within the family, the larger community, and given the terrible social backlash that the bar girls in Mumbai had been subjected to just a little earlier. This resulted in the bars being closed and the girls being hounded out. Meanwhile, in Bagalkot, Karnataka, the Chaitanya Mahila Sangha decided to host 19 journalists from the state and the national media. But before doing so, the journalists had to be educated and sensitized about the sex workers' intervention run by the Sangha, because a sizable section of sex workers were from the Devadasi community. The collective faced the uphill task of sensitizing journalists about an intervention led by peer educators who continued to practice sex work while explaining a context which was strongly influenced by a tradition called Devadasi. The advocacy with the media had to be readied at many levels. Given the bar girls' experience, the women from the Mukta project decided to win over and work with a societal leader or a highly acclaimed actor before reaching out to the media. The Chaitanya Mahila Sangha members decided to focus on demystifying the Devadasi tradition to ensure that their realities as sex workers were understood.
ನಮಗೂ ಗೊತ್ತಿಲ್ಲರಿ ದೇವದಾಸಿ ಪದ್ಧತಿ ಕೊಡೋದ್ರಿ. ಆಮೇಲೆ ನಮ್ಮ ತಾಯಿ ತಂದೆಗೂ ಗೊತ್ತಿಲ್ಲ, ನಮ್ಮ ಅಜ್ಜ ಮತ್ತೆ ಕಾಲಿಗೂ ಗೊತ್ತಿಲ್ಲ. ಇದು ಯಾವುದೋ ಒಂದು ಕಾಲದಾಗ ಇಲ್ಲೇ ಒಂದು ತಲೆತಲಾಂತರದಿಂದ ಬಂದದ್ರಿ ಇದು ಪದ್ಧತಿ.
How did the community address these concerns? Both the groups trained themselves as hosts, presenters, and interviewees. They worked out key messages, and they learned to respond to difficult questions. So finally, did this effort make a difference? Definitely, we did make some incremental and qualitative gains. By 2008, we saw some change. The question was, how could we qualify this change? Having tracked 55,290 news reports on HIV/AIDS across 6 states from the year 2005 to 2010, we found that 19,753 reports were community-centered. If we focused on the data for 3 years, from 2006 to 2008, we discovered that out of a total of 31,386 news reports, 10,938 or 35% news reports were dealing with the marginal communities. This implied that the human face of the epidemic had begun to grow. What is significant is that such reports increased from 2,457 news reports in 2006 to 4,301 in 2008. The question that arose was, what was the quality of the representation? Did the media focus on the contribution that the community groups made towards empowerment and exposing human rights violations, or to strengthening HIV prevention? If we compare the 3 years from 2006 to 2008, what stands out is the shift in the quality of representation of marginal communities. Out of the 10,938 news reports, 2,501 reports related to community empowerment and their endeavor to access social entitlements. In 1,357 reports, the community spoke up about human rights violations that the community members had experienced. And as many as 4,100 reports focused on the community's contribution to HIV prevention, care, and support. With these figures adding up to 7,958, it amounted to a little over 72% of the reports. In comparison, we find that the negative reports totaled up to 2,989, which accounted for a little over 27% of the total coverage on community-centered reports. In other words, the coverage was reasonably supportive and inclusive. If we have to identify one factor that made a difference, it was the widespread media sensitization and consultation that was conducted across 6 high-prevalence states. This resulted in a greater dialogue between the community representatives and the media on how to craft and treat issues, and this in turn led to greater reflection and relationship building. Having said all this, it is premature to state that all is well. The challenge not only remains, but has in a sense worsened. What with the so-called viewer and reader ratings or TRPs, encouraging highly intrusive and insensitive reporting in both the print and the electronic media, and the major challenge for the community is the genre of crime reporting. This is where the marginal communities who are fighting an age-old battle to decriminalize their identity, work, sexual orientation, health concerns are all facing the maximum threat. It is in this context that a regulatory framework assumes urgency for marginal communities. What is the road ahead? Under the leadership and guidance of the Press Council of India, strengthen ethical practices by awarding journalists who uphold the highest professional ethical standards. Give communities most impacted by the depiction representation in the panel or the jury that decides the award. Spread awareness and ownership of the guidelines amongst the media leadership and practitioners. Encourage communities to support the Press Council of India by playing a watchdog and monitoring role. Develop all language and electronic versions of the guidelines. establish an online feedback and complaint mechanism to encourage greater participation in interpreting and voicing public views and experiences about the guidelines. Conduct participatory and democratic reviews and dialogue with the decision makers of the media to strengthen self-regulation.